Hi everybody, this is Dr. Anthony Bacevice, past president of the Academy of Medicine of Cleveland and Northern Ohio. Today, I have the pleasure of talking with Dr. Fred Jorgensen. Dr. Jorgensen will soon assume the reins of president of the Academy of Medicine for the coming year. Tell us about yourself.
I'm a family physician.
Okay.
I've been a family physician pretty much my whole career. And I started at Fairview Hospital Family Medicine Residency. I did my residency there, and then I planned maybe on going back to New York, but I met my wife out here and she doesn't like New York. So I ended up staying in Cleveland, and the residency needed a faculty member, and I signed on.
Excellent.
So I've been with the program my whole career. My main focus at the residency has been as medical director of the residency-based practice. So that's kind of how I got involved in the business end of it.
What got you interested in medicine, Dr. Jorgensen?
Well, I had no medical background in my family, so I'm the first. And basically, rumor has it when I was a little kid, my brother got hurt body surfing and hurt his neck, and we took him to the emergency room. And I was very concerned about it, so it was kind of a very emotionally charged event.
Sure.
And something about the doctor, his persona, I seem to think he wasn't the nicest person. He was an emergency room doctor, and this was back in the 60s.
Sure, sure.
So I said, boy, I could do that. And that was the last I heard of it. And then as I went through high school and college, I took a course in anatomy and physiology in high school, which was kind of an odd course to take in high school. But I took it. It came natural. I enjoyed it. I started to volunteer a little bit at nursing homes. I enjoyed taking care of sick people and being in that environment. And that's how I ended up in medicine. Yeah, and I think what we're living through now, I like to call it, when I talk to students, recruits for the residency, we're kind of in the third iteration of the rise of primary care.
Yes.
The first one was really when family medicine became a specialty, because back in the old days it was general medicine, you would be a GP. But then as things got more complex, we became, a ACGME approved specialty. And so that was the birth of family medicine, and that was probably in the early 70s to mid 70s. So that was our first rise. The second rise was during the managed care revolution in the 90s, where everyone was trying to build primary care bases, because primary care was kind of, as you said, the base of the system, the entry point to the system. But then for political reasons and other reasons, that fell apart. And now we have the third rise of primary care, really, with the focus on value-based payment systems and ACOs.
And that becomes extremely important in the modern era when there is so much care that needs to be given to patients. There's so many complex problems we have to deal with, and we recognize that there's a limited amount of resources available to pay for that. So it's very important to be good stewards of how we deliver care. And I think people like yourself and the people you teach in the primary care field are in a great position for that.
Yeah. And we're really, we are needing to take a different focus, because now because of the new value-based payment and population management, we're having to teach our residents some different things that we didn't have to do.
Things that you and I never learned in residency.
Well, things like leadership skills, much more emphasized now. Teamwork, much more emphasized now.
Yes.
We actually train these things. There's competencies around teamwork, around leadership, and then around population health, where you're trying to manage not only the person in front of you, which has been the traditional focus of medicine, but now you're trying to manage this whole community of people that are out there, maybe not coming to the doctor, maybe not interfacing with the system at all, but they're out there with diseases, with medical costs, et cetera, and we have to manage that.
Yeah, that becomes very important.
Yeah.
Tell me about your family, Dr. Jorgensen.
Well, my family, I've been married to my wife, Sandy. She's a geriatric nurse practitioner.
Excellent.
Who's also been involved in organized nursing. She's been president of a couple of the local and statewide nursing associations. So we have interesting conversations about the interplay between doctors and especially advanced practice nurses. We've raised two sons, one a business consultant and one an electrical engineer.
Excellent. What about your goals for the Academy of Medicine as taking the reins of president now? For the next 12 months, you have a very important role as being the advocate and the spokesperson for a few thousand physicians here in Northern Ohio that depend on the Academy for being good advocates of the kinds of information that need to be brought forward to the community, to legislature, and so forth. So what are your thoughts and what are your goals for this coming year?
Well, I think the Academy has played a tremendous role in advocating for physicians in the area of legislation, in the area of organized healthcare, to try to have some seat at the table as our healthcare system is redesigned and has gone through various redesigns
Sure.
over the years. I think an important topic right now is physician wellness. I'm concerned about that. I mean, as you know, you can't pick up a magazine these days without reading about physician burnout and the concern about that. And we see it in the residencies. It's really it's a hot topic. And I think as the Academy is basically an organization that represents physicians, I think that'll be an important thing to start to take a look at, along with some of the other organizations. What's at the root of it? What can we do about it? We want more time with our patients. Right?
Sure.
So especially
Absolutely.
in primary care, one of the main concerns about primary care physicians these days is the pressure to see more, do more, quicker. And it takes us away from the face-to-face encounter with the patient, or minimizes that.
Now we spend our time looking at a computer screen instead of the patient.
Right. And there's an amazing article just came out in the Green Journal today about that, actually looking at, they did time motion studies of residents and found that typical resident day, about 9% of the time face-to-face with a patient, 57% of the time face-to-face with a computer, and about 11-12% was on educational activities of some sort. So don't quote me on the numbers, but they're close. And that points out that's happening in training, it's also happening in practice. So that is, to me, a large contributor to what leads to physician burnout. So I think the Academy can have some role, hopefully, in working with our membership, maybe informing groups, employers, insurance companies. I'm not sure who. I haven't quite figured that out yet, but we need to get a handle on that.
Yeah. Well, you've got a year to do that, that's for sure, Dr. Jorgensen.
Good.
What would you like to see of our membership?
Well, I would like to see more younger members getting more involved, enough to understand the issues. So to be informed, be able to speak to the issues. And then as they get further into their careers, so the mid-range career doctors, to really start to get involved with the Academy and groups that can maybe influence our situation.
Well, we have many committees and groups within the Academy of Medicine of Cleveland, and for any physician who is a member and would like to get involved, all they need to do is call the Academy at their offices at area code 216-520-1000 and ask one of the staff members for information about committee activities and so forth. Also through our publication, Northern Ohio Physician, more information is available about what we're doing as well as how people can get involved. Yeah. Any parting comments for us, Dr. Jorgensen?
Well, the parting comments, I think, mainly involve the importance of physicians having a seat at the table as the healthcare system is changed and redesigned. I mean, I think we're at a key moment now where in this country we're seeing a big division, just politically and value-wise, of haves and have-nots. And what we saw with the Affordable Care Act is the have-nots getting health insurance, many of them for the first time. And now that's at risk. And additionally, we're seeing the middle class stuck in a situation where their incomes have not been rising. And part of that is due to healthcare costs. So I think we as physicians, based on our training, our ethics, our bonds with our patients, need to be involved as this healthcare system is fixed or redesigned. Otherwise, I think everybody's going to suffer.
Well, those are a few sobering words for us to all give some consideration to. Dr. Jorgensen, I want to thank you for your time this afternoon. It is afternoon here while we're recording this. And I want to wish you the best of luck in your forthcoming year as president of our Academy of Medicine.